Ladies and gentlemen, hi, my name is Roberto Acosta, and this is my volunteer patient, Miss Daniela, and today we are going to be performing an abdominal examination. So let's begin. So the first thing that we want to do is make sure that the client has an empty bladder. We also want to make sure that the client assumes a comfortable position, have a head on the pillow, arms should be relaxed alongside of the abdomen. I also want to ask the client to point out any painful areas. During palpitation portion of the examination, these areas should obviously be examined if there's anything that stands out. Do you have any painful areas in your abdomen? Okay. So another thing that we want to consider is we want to warm up the stethoscope before auscultating to avoid any sudden movements and use conversation to help the client at ease. So also during inspection, we want to visualize the organs in each region of throughout the examination and also monitor the client for any facial expressions or any signs of discomfort. So Daniela, the physical examination is going to consist of 4 parts. We have inspection, auscultation, percussion, and then palpation, okay? So during inspection, I'm looking for any signs of pathology, including discoloration, rashes, any dilated veins, the contour of the abdomen. I want to evaluate for any distension, asymmetry, abnormal pulsations. Hands to the side, please. Thank you, ma'am. Or any protuberances. I want to make note of any scars during inspection, which may help uncover important facts about the client's medical history. For example, a scar located in the right lower quadrant can suggest an appendectomy, or asymmetry of the abdomen due to localized protrusion may suggest an inguinal hernia. During the auscultation, I am assessing the quality and frequency of sounds made by the digestive processes and air moving through the bowels. Bowel sounds are often high-pitched, so the diaphragm of the stethoscope is used for this part of the assessment. It's best practice to listen to all quadrants in a clockwise fashion, beginning at the right lower quadrant, then the right upper quadrant, the left upper quadrant, and lastly the left lower quadrant. There are 3 types of bowel sounds. There's normal active, hyperactive, and hypoactive. So we are going to listen. So your bowel sounds are normal active, as expected. So during percussion, I'm assessing the organs and screening for masses. There are 2 basic types of sounds when percussing. One is tympanic, the other one is dual. Tympanic sounds occur over areas that contain air, such as the normal intestines. And then dual sounds occur over areas that are distended, fluid-filled, or dense, such as the liver. Tympanic sounds are typically predominate the sounds. So there is a third percussion sound, which is referred to as resonance, and this is normally heard over the lungs. So we're going to begin percussing, starting over at the right lower quadrant. So when percussing, we're expecting to hear primarily tympanic sounds, except over the liver, the spleen, a distended bladder, fluid, or a mass. Scattered dullness in the lower quadrants usually indicates fecal matter in the colon. Now, percussing over the liver span, I expect to find resonance over the right lung in the midclavicular line, then percuss downwards until I find dullness. So I'm going to go ahead and percuss here, okay? So moving downwards until I find, or until I hear dullness. Then I'll find tympani in the right upper quadrant and percuss up to the midclavicular line until I hear dullness. I'm going to percuss over the liver span, which is right over the right lung here in the midclavicular line. And I'm going to basically percuss downwards until I find dullness. When I find or listen to the tympani in the right upper quadrant, I'll then percuss up into the midclavicular line until I can hear dullness. So let me try this again. Okay. So the distance between these 2 edges in the liver span is basically what it's what we're looking for in order to assess the liver. And in the normal adult, the liver should measure anywhere from 6 to 12 centimeters in diameter. So now we're going to be moving to the left upper quadrant, percussing over the spleen, and which I expect to find dullness above the 9th intercostal space, which is, right about here, which is in the mid-axillary line. So the first sound that I should hear should be resonant, and I work my way down until I find the upper border of the spleen. Normally in the area of the splenic dullness is located between the 9th and the 11th intercostal spaces, and is less than 7 centimeters wide. And usually in a healthy person, we're not expecting to be able to palpate the spleen. If it is enlarged, then we would be able to palpate. So it's expected to not, show. Okay, now we're gonna be moving to palpation. So now palpate the abdomen to assess the organs, find any masses, and locate any tender areas. Palpation is performed last because it can shift organs and masses, or it may affect digestive processes, which would alter findings in other parts of the examination. So there's two types of palpation. We have light and deep. Light palpation is done at a depth of 1 centimeter, and it is always performed before deep palpation because they may help the client relax and will alert me to any areas that should be treated with caution during the examination. So I'm going to be palpating just very gently, okay? So it's important to observe the client's facial expressions and body language for any signs of pain or discomfort. All right, once we finish with that, we're gonna move over to a deep palpation, which is performed at about 5 to 8 centimeters. And this is performed to determine the size and location of the organs, to check more thoroughly for masses and rebound tenderness. So please let me know if you feel any pain or tenderness at any point, okay?
Okay.
In a healthy client during deep palpation, I expect to feel the liver edge, the aorta, which is right on the left side of the midline here, and the sigmoid section of the colon. The bladder is normally palpable only when it's full, and you clearly have an empty bladder right now. In a normal abdomen, I shouldn't expect to palpate any masses, any rebound tenderness, or enlarged organs. So I'll start at the right lower quadrant and move clockwise. First with light palpation, then with deep palpation, moving upwards to the right upper quadrant, where I will palpate to examine the liver. The liver is normally palpable in the right upper quadrant, which is this area right here, just below the costal margin at the midclavicular line. Only an enlarged liver is palpable more than 1 to 2 centimeters below the right costal margin. So now palpating to assess both kidneys. Kidneys are located at the posterior of the upper quadrants, directly behind the costal vertebral angle. I'm sorry, I'm tickling you. Normally the kidneys will not be palpable, and an enlarged kidney can be felt by hooking under the flank with one hand and deeply palpating the interior abdomen with the other. So in this case, I can't feel your kidneys through this palpation here, however. Lastly, I will palpate to examine the abdominal aorta. To determine the width of the abdominal aorta, I want to palpate right above the umbilicus, just left of the midline, and press in towards the pulsation. The width of a normal adult abdominal aorta is approximately 3 centimeters. Yes. Yeah. So now we're going to be conducting a cost over the vertebrae angle percussion test, which is going to be right over the kidneys. And so here we're checking for any kidney disorders. A positive finding on this test would be pain with the firm thump of the fisted hand. So I'm going to palpate looking for the costal vertebrae angle at the 12th rib place. I'll place my non-dominant hand over that costal vertebrae angle and then test the left kidney by producing one firm thud over that area. You okay? Okay. Let's try this again.
No, that's fine.
All right, here we go. Okay, and then we'll do the same thing to the right side. This should be a painless, unless, of course, there's any issues with the kidney. So, good. All right, one more time. Hold on. Okay. Okay. And that completes the abdominal examination. Thank you.